We'll move on into our panel discussion portion now. Well, I invite all of our panelists to answer a couple of these questions. I wanted to start with one question that has come up a couple of times in the chat box. We've talked a lot about the issues and the progress that we can make on addressing this with legislation, but do any of our panelists have advice for folks in the meantime, while we don't have legislation on this issue? What can people who are impacted by surprise medical bills do? Is there any way to prevent this from happening, or any way to fight this if someone is affected by a surprise bill? I invite any of you to jump in and answer.
Well, we still get calls because our legislation is not in effect about what consumers should do about this. You know, we advise that consumers always get an itemized bill. So ask your provider facility for the most itemized bill they can provide, and then negotiate with them. I mean, apply for any financial assistance programs that are available, but also negotiate. And there are many kind of tools and ways to do that. But those are kind of that's the broad advice we give to folks.
Yeah, this is Senator Watson. I find that particularly on the hospital side of the world, that hospitals really want to work with patients. They have financial advisors who are there. Hospitals will make significant discounts. Now, they can't control what happens with a physician who is not part of the hospital system. But even the clinicians want to take care of patients. They don't want to deal with all this stuff. And so it's been my experience that patients often find if they sit down and have a conversation with the business office of the hospital or the business office in a physician's office, that they will work with them to the best of their ability that they possibly can.
I know I'm not on the panel, but we had hoped to have someone from the Tennessee Department of Commerce and Insurance be present, but they had an emergency, which opened up the door for Laura to join us. So it worked out pretty well, I think. But they do offer some assistance to consumers who bring concerns and complaints to their attention. And it would be, as I understand it, somewhat of a mediation where they would help the consumer contact the financial office of the hospital or the provider's office and try to get, the parties to sit down together and work something out. So I don't know how often they do that, but I know that, there is a consumer division and that's their role in the meantime.
Thank you for that comment, Claire. I see, Senator Watson, you put in the chat that covering the uninsured is part of the Tennessee legislation. So I was wondering if I could just broaden that question and if anyone else wants to comment on how different types of legislation can affect uninsured consumers as well.
I can say something about that. I have seen in various state legislation that uninsured individuals have the ability to trigger an arbitration for themselves. So if they do receive a bill that they would like to dispute that is a surprise medical bill, they are able to trigger an arbitration if an arbitration model is included in the legislation, which it almost always is. So I have seen a few states, can't remember them off the top of my head, unfortunately, but it is something that states have. And there is one thing I did want to add in terms of, I saw a couple of questions in the chat box about kind of what we were talking about right before this about what's the best way to prevent a surprise medical bill. And I think sometimes it's important to clarify what a surprise medical bill is and isn't. So a surprise medical bill isn't when you go to a hospital or facility and you're surprised by the bill that you get, right? Because it happens to all of us, happens to me. Like I go in for healthcare, I'm like, I had no idea that was $900, but that is a surprise in and of itself, but that's not what the legislation is fixing for, right? A surprise medical bill is that very specific instance that, the patient is unable to determine whether it's an out-of-network service, like in an emergency situation, or they had the belief that they were at an in-network hospital, or everything is in-network except for the singular, out-of-network provider in a surgical case. So in that scenario, in true surprise medical billing scenario, I think it's almost impossible to predict when it's going to happen. And I think that's what makes it so so predatory and such an egregious market failure, is that that information is just not there. So I would just echo what everyone else said about in terms of advocating for yourself, calling your hospital, call your insurer, try and figure something out. It's a very tedious process. I recently went through it myself. It is very frustrating, even as someone who understands how these systems work. It's very frustrating. But yeah, I just wanted to add that also.
Thank you. I think this is a good question. While the provider and the insurer argue about the legislation, the consumer is stuck with the bill. What is the incentive for providers and insurers to reach a resolution? I know Senator Watson alluded to this, and it's not like providers really want to stick patients with bills, but and Laura alluded to this too. If there's been this tug of war between those two groups, and how do we really incentivize them to come to a solution that benefits patients?
Well, therein lies the challenge. Because everybody wants to be a winner in the process. And as was alluded to earlier, this kind of, the challenge with compromise is that everybody doesn't get what they want. Everybody wants to talk about compromise, and everybody asks legislators to reach a compromise, but a compromise means I don't get everything I want, and you don't get everything you want. And therein lies the biggest challenge that we face with this. There's just not a simple answer. But again, I would point out that my view is that we have roughly 30 states that have come up with various solutions. And I just believe that the state of Tennessee should be able to look at those many solutions and choose what works best in Tennessee, because this is not a problem that will go away on its own. I would be one, I guess, because I serve at the state level, who would say, I want to see my state come up with the solution. I don't want to see the federal government give me the solution that I'd implement in my state. So, but you're right. The incentive is not to do anything. Because the provider can continue to balance bill and the payer can continue to pay what they want to pay for in and out of network services. Creating an incentive really is dependent upon consumers telling their stories and helping legislators decide that the incentive is not a financial one. The incentive is doing what is in the best interest of the patients.
I cannot nod vigorously enough to Senator Watson's comments. We had this dynamic in Georgia for 4.5 years. It really doesn't harm insurers or providers when there's not a solution to balance billing. It only harms consumers. And I remember talking with some folks some peers in California after they had passed comprehensive surprise billing protections. And they said what it took was having legislative leaders who didn't care about making the provider or insurance communities a little bit upset. And that's what it came down to in Georgia, is our legislators getting so impatient with those industry stakeholders about dragging their feet that they just said, we're doing our own solution, and you can get on board or you can get out of the way. And that's kind of what it took. There isn't an incentive for those stakeholders to come to the table. So you kind of need very committed folks like Senator Watson to really be very bullheaded about it and just charge forward.
Just seeing some of the comments in the comment box, I did want to comment on some of the kind of mechanics behind what is going on and why it happens. So in Tennessee, like in a lot of states, actually, we have what are called corporate practice of medicine laws, which actually keep hospitals from directly employing physicians. There are some exceptions in place for teaching hospitals like Vanderbilt and UT. And so that means that almost every physician that works at a hospital is not directly employed by that hospital. So that's why you have these separate contract negotiations going on with health insurance companies. Is the hospital may contract with your health insurance company, but the physician or the physician group that physician is employed by is actually the one making the negotiations with the health insurance companies. And it's also what can make it really confusing for consumers and patients when they start to receive these bills, because they might not even see their doctor's name on one of these bills. They might see something like Southwestern Emergency Physician Group, and they think, well, I don't know what that is. And a lot of times what ends up with all these like downstream terrible effects that we have in the medical debt video is that maybe you think, oh, this is a mistake. I've never heard of this group before. And you might ignore it or not pay it. And then you end up having debt collectors coming for you and potentially being sued in court and things like that. So that's sort of the mechanics and the legal structure behind some of what's going on and why it can be so confusing for a patient.
Thank you, Mandy. In the interest of time, I just want to ask one final question for each of our panelists, and that is there any advice that you would give to the people on this call or other constituents who want to make their voices heard and say that this is an important issue? Is there anything that we can do as citizens to say that this is something we need our state to focus on?
I can go. Families USA it chairs a campaign called No Surprises campaign at the federal level, and has been doing so for months. And that's our goal, is to amplify consumer voices, because as we were talking about, industry doesn't really have a huge, whole lot of skin in this game. Like there's no incentive for them. So really, it's the onus is on us, and the onus is on people who are really going through these horrible market failures and like really feeling the brunt of failure of Congress to act. And so if there's any way I can share a link, we through the No Surprises campaign, we collect patient stories and we use it to amplify. So we post them on our website, and we use it in our materials that we send to the Hill, and really try and highlight the struggles that real people are facing. And I would say that that's one great way to get involved and have your voices heard.
I want to say what the legislative professionals on this call already know, but for some of you may not, or you may not think of it. Legislators vote their district first. So for a lot of people who live in the Nashville area, for example, in Tennessee, to talk about this problem doesn't necessarily have an impact on the people who live in East and West Tennessee. What's important is that there is a broad coalition of people telling their story. So people need to hear the story from people in Upper East Tennessee and Southeast Tennessee and West Tennessee, and not just from people who live around Nashville, because the state is represented by people from all across the state. And so I would encourage you, obviously, stories matter. Facts are important, stories matter. And to a legislator living in Giles County, Tennessee, he or she wants to hear from the people in Giles County. So from that vantage point, that's what legislators will react, and that's what legislators will respond to. So I would encourage you to build a very broad coalition of folks who help make the argument for folks like me around balanced billing.
I endorse both Natasha and Senator Watson's comments. Stories are very important, and the broad coalition is necessary. So I think those are two important pieces of advice.
All right, well, in the interest of time, I just want to thank our panelists one more time. I know Senator Watson is doing this while he's traveling. And as we just heard, sharing your stories are incredibly important. Thank you to Steve for being here. Thank you, Laura, for showing us, what has worked in Georgia. Mandy, that presentation was amazing of laying out what the landscape is. And Natasha, thank you for sharing, what's going on the federal level and how Families USA is involved in that. This has been a fantastic panel, and I think really, really informative. So thank you all, not just for presenting here today, but also for all of your efforts that each of you have had in protecting patients really across our state and across the country. I'd also like to just give one more quick thank you to Tony Garr, who many of you know is a fierce advocate for Tennesseans and has been really instrumental in putting this panel together. I'd also like to take a minute to say if you enjoyed this presentation and you want to support the work that advocates like us at the Tennessee Healthcare Campaign are doing, any donations would be greatly appreciated. And I'd just like to turn it over to Claire for just a quick minute to close us out for this session. Thank you all so much. Claire, you're on mute.
Sorry. I'd like for us to give a virtual round of applause to everybody, whatever it is that you do on this Zoom system. But I also want to say that we would really appreciate your feedback from those of you who are attending this session. I think there is a slide that may or may not come up that has a link to an evaluation form, but we will have we'll have these slides, I hope, from the presentation, video of the presentation, and resources that were mentioned in the presentation, including links to Families USA's campaign posted on our website. Just give us a few days to get all that together. And one other thing, I just wanted to remind people that next Saturday on Halloween morning, we're going to look at another health equity issue, and it, I think it kind of links into the discussion here today, but we're going to report on 3 years of research that the healthcare campaign has been doing with researchers from Vanderbilt University Medical Center. What we've done is gone into counties that have recently lost a community hospital and talked with them about the impacts that they've seen in their county and their community and what the solutions are that they think are important to rebuild their community health systems. We'd like to share that information with all of you and again, talk with you about how to move forward. And we will be following this up. We will be in touch. I hope, Senator Watson has always been open to our conversations with him about how we can be supportive in this effort. And we will, try to keep everybody involved when there is legislation next year. So please be looking for information about that as we go forward. Thank you all so very much, for being here today. And hopefully I'll see some of you next Saturday as well. Thanks.
Thank you.